So very briefly on COVID, obviously we're following the Omicron surge, which is impacting our community just as it is every other community. The bad news is that the cases are through the roof, historic highs. The good news is the hospitalizations are rising, but not as much as they had in previous waves relative to cases. Now, we don't know yet whether or not this wave can overwhelm our hospitals or not. And that's why what we continue to ask people is to get vaccinated and to get their booster. Folks with the booster, with the vaccination, much less likely to end up in the hospitals. And obviously, to the extent that our hospitals are full of COVID patients, that's when we have to divert the heart attacks and the strokes and the other resolvable issues. Now, we are hearing from some hospitals that they're needing additional staff because so much staff is out sick, and so we're receiving additional staff, around 900 additional staff here in the coming week for our region. Another thing that we have on Commissioner's Court today that I hope will be approved is funding almost $1 million for tests, for rapid tests to our schools. We hope to be able to provide kids with these tests who are symptomatic, who come into contact with somebody that has COVID, so if they get a negative test, they can go back to school. That'll help us keep our kids in school. It'll also help us control the virus. And of course, I want to remind folks there's plenty of testing capacity at our Harris County testing sites. Those are for the PCR tests. The results take a little bit longer to come back. Of course, they're more accurate. So you can sign up for that at readyharris.org. And his question was whether we'll be increasing the threat level to red. Right now, 3 indicators are in red. One of them is in orange. The one in orange is the hospitalizations. 12% of the ICU population is COVID positive. If we get to 20%, then we'll be at red. And that's completely in our hands. We can control that. If we get our vaccination, get our booster, that will keep folks from going to the hospital because of COVID. And so let's keep that from happening. It could happen in the next week or two if our hospitalizations continue to increase. And we are ready and on standby to open more testing sites from Harris County Public Health, but right now we're about at 80% capacity. So if you need a test, come on by, register at readyharris.org, but we are ready to go with vendors. If we need more sites, we'll open up more sites.